I'm Dr. Giles. I'm a chiropractic physician, and I specialize in health and well-being and coaching other doctors how to do a few of these wonderful treatment programs. So let's just jump right into it. Caution: when speaking of statistics, averages, or what is considered normal, keep in mind that all women are unique. Don't mistake a difference for a deficiency. And I like this over here. Oprah Winfrey said, "Create the highest, greatest vision possible for your life, because you become what you believe." And that we can be better in everything that we do. And as well, each individual, each woman, each man is unique. So let's just talk a little bit more specifically of how this all works. So all your eggs in one basket has been the idea for many years. So females are believed to be born with a finite number of eggs stored within the ovaries. Current science believes that women have the following egg count. So during fetal life, 6 to 7 million. At birth, about 1 million. At puberty, 300,000. And on average, only 300 to 400 will be ovulated. However, modern scientific studies discovered a new type of stem cell, this is interesting, in the ovaries that when grown in laboratories generate egg cells. So as of 2004, the notion that you are born with a limited number of eggs is now being questioned. Here's the information there. But roughly 300 to 400 will be ovulated during that normal cycle. So menses is measured by the first day of bleeding. So the average cycle in a teen would be up to 45 days grown over the years. So, and ultimately becoming about 25 or 28 days. So 25 to 35 days, most cycles are, that's how it is. So lasting about 21 to 35 days. 40 to 42, the cycle tends to be shortest, as far as you might only have 1 or 2 days of bleeding. And then 42 to menopause, often longer and less predictable. That's what's difficult about going into menopause, when your cycle is coming. Most females know, okay, it's going to come on roughly this day, and so I can prepare for that. But not knowing when it's coming, that would be very difficult. So I always have my hat off with utmost respect for women, just for what they have to put up with monthly, and their ability to propagate life. What an amazing, beautiful thing that is, and the birth process and what their bodies go through in order to propagate our species is just amazing. So average menstrual cycle length is 28 days, average period 3 to 5 days. At the turn of the 20th century, the average age for the girls' first period was between 16 and 17. But today that normally is usually around age 12. Some attribute this to environmental toxins. I would suggest that the different toxins within our chicken and beef, the hormones that are placed within the chicken to plump their breasts, I'm sure that's affecting our young girls, and that's why they're starting earlier. When we miss a cycle, there's ideas and things that can cause this. So missed cycles can be from a thyroid pituitary gland disorder, hypothalamus disorder. Breastfeeding can create missed cycles, obesity, oral contraceptives, stress, polycystic ovarian syndrome, ovarian failure or the loss of function prior to menopause, and then uterus disease or fibroids, endometriosis, those kind of things. That can create a missed cycle. So heavier periods, menorrhea or heavy periods is greater than 5 or more tablespoons of blood monthly. I was sure there was more than 5 tablespoons. A lot of my patients will change a pad 3 and 4 or 5 times the first couple of days. And I'm thinking, well, that must be quite a bit of blood in order to, and some of them are changing them per hour. Now those would be hemorrhaging and really moving out. And so we kind of have to watch those. When they do hemorrhage or have a lot of blood flow, I usually suggest a larger amount of trace mineral. So heavy periods can be caused by non-cancerous uterine fibroids or polyps, miscarriage or ectopic pregnancy, certain drugs, blood thinners, steroids, birth control changes, clotting disorders, Van Willebrand's disease, and cancer of the uterus. So these are some of the ideas and reasons why there's heavier bleeding. The hormone controlling organs then with the pituitary. It is the gatekeeper and it's in charge of the endocrine system. But the hypothalamus is above the pituitary. And for so long, I only focused on the pituitary. A practitioner over in Europe talked about hypothalamitis, or an inflammation of the hypothalamus. He was from Scotland. And when it becomes inflamed, it doesn't do its normal activity. So hypothalamitis is seen in patients who have a lot of like lupus or multiple sclerosis. So those are things, experiences when the hypothalamus becomes completely inflamed. So we would work with hypothala would be a great one to work on that position. But it's so important to be able to do kinesiology to determine at what point you need to enter as a practitioner and support the patient. Do we support it at the hypothalamus, at the pituitary, at the ovary uterus? Where is it that we need support? So that's done through kinesiology and through this questionnaire that I'll show you here in just a little bit. So hormone imbalances are normal when they bring upon puberty, menopause, and perimenopause naturally, and they create the cycle needed for pregnancy. So that imbalance is balance. That up and down yin-yang of the cycle is the balance, but that's controlled by the pituitary and the hypothalamus. So there are basically four primary female sex hormones controlled by the endocrine system. So estrogen, progesterone, follicle-stimulating hormones, and luteinizing hormone. So luteinizing hormone is the one that creates the follicle, causes it to expel the egg. We'll discuss kind of how they flow here in a minute. So hormone imbalances are not normal when they are caused by toxins or unbalanced lifestyles. So such as chronic stress creates cortisol, causing imbalances in other hormones. So prolonged stress tears up our bones, melts our muscles, robs us of strength and energy, lowers our libido, and overwhelms our immunities, putting us at serious risk for chronic illness and autoimmune diseases. That's what I was talking about, the autoimmune part of the hypothalamitis, the inflammatory state. And as we look at the questionnaire here in a minute, that's the first thing we address is the inflammatory state of hot flashing, of PMS. Those can be autoimmune enhanced, but mainly they are inflammatory. And through the diet, that's another thing. So other imbalances can cause, such as belly fat, obesity, insulin resistance, breast cancer. Hormonal imbalances can be estrogen dominance, progesterone deficiency, and testosterone increases or decreases. When we have not enough testosterone, then the libido drops. Testosterone is the mover. It's the one that gets you up and moving, charging forward. Women need that. But they have 1/16 the amount of testosterone that males do. The estrogen dominance, though, is something that we see with most women, well, all of us, because of what we're living in. We have xenoestrogens that are from plastics, carpet, paint, all kinds of things, plus the estrogen that we're getting from eating beef and chicken, unless they're free range. But now I don't know too many people that eat, as far as my patients go, that eat free range. And then the progesterone deficiency is a really big one. This was interesting and sad. This was in the news here. Dutee Chand, an Indian athlete. So in the news, June 29th, 2016, International Olympic Committee attempts to ban female athletes with naturally high levels of testosterone. So gender testing is done to catch male athletes that are masquerading as women. Advocates argue that actually discriminate against intersex women. So this Indian runner, Dutee Chand, has endured invasive gender testing and deemed ineligible to compete since she has naturally high levels of testosterone. So the recent ruling from the IOC said women with this condition should be allowed to compete against men. Advocates call this humiliating. So that's a difficult thing. If she has a high amount of testosterone, then she acts more like, her musculature acts more like a male. She's definitely a female, there's no question. So that's a very interesting, sad issue. Okay, here's the follicle, and here's the egg being expelled. So here's the ovary. And this is the surgical instrument holding that back so you can see. So this is a 2008 human ovulation clearly photographed for the first time in history. That's amazing. So, the 4 phases of normal female cycle as directed by the 4 previously discussed hormones. So there's a proliferative phase. This is where ovarian follicles are primed for ovulation. A typical cycle will have only 1 egg becoming mature enough for ovulation. 2, the secretory or ovulatory phase. Hormones surge, helping dominant egg to break free and nest in the fallopian tube. If not fertilized in 12 to 24 hours, the egg will degenerate. This is the cycle where a woman can get pregnant. So a reminder, sperm can live up to 5 days. Secretory or ovulatory phase. The luteal phase, the follicle that released the egg transforms into the corpus luteum, or Latin yellow body, a structure that secretes the hormone progesterone, which makes the lining of the uterus thick for implantation. The corpus luteum lasts about 12 to 14 days unless the egg is not fertilized, then otherwise dies. Then the menses phase, triggered when the corpus luteum of the last cycle's unfertilized egg ceases to produce progesterone. Length and intensity varies from women to women and cycle to cycle. Once the period stops, the proliferative stage begins again. So that's a nice view of how that looks. And that's ovulation, of course, at the very top there. So when we have PMS and other kind of symptoms, it's when we have too much estrogen and too much progesterone and not enough and so forth. Usually PMS is when we have too much estrogen in the late luteal phase. Okay, hormone imbalances continued. So sex hormones imbalances may also lead to dysmenorrhea, amenorrhea. Dysmenorrhea means no menses. No, excuse me. Dys is mal or bad, ineffective menses. Amenorrhea is without or non-menstruation. Premenstrual syndrome, and that again, that's more of an inflammatory state. Too much estrogen creates inflammation. In fact, estrogen itself is inflammatory. Even though estrogen is what creates softness in women, it's also too much is pro-inflammatory. Hot flashes, mood swings, and ovulatory cycles, and absence of ovulation and luteal phase, and then corpus luteum defect. This is when the corpus luteum does not produce enough progesterone to allow a pregnancy to develop. Without sufficient levels, the uterus lining will shed and resulting in a miscarriage. Now this is interesting, this is what I was telling you earlier. Men periods, male PMS or IMS, irritable male syndrome, is attributed to men experiencing a drop in testosterone. So this what happens as we age, our testosterone diminishes. So that's the big thing is to support that. Now, men as well need progesterone. This was interesting. I like this, hot flashes. I don't have hot flashes. I have short private vacations in the tropics. Gotta love that. So hot flashes, the reason why this happens, some do not experience hot flashes at all in menopause. For other women, hot flashes may be unbearable and the most dreaded symptom of all, believed to have been caused by low levels of estrogen that affects the hypothalamus. Hypothalamus regulates the body temperature. The brain detects too much or body heat. The brain releases hormones to cool the body. These hormones increase heart rate. Blood vessels dilate, increasing flow to cool. And then the body's natural cooling method is to sweat. So that's the heating and sweating of that. That's the concept of what happens or why those hot flashes are there. So 25 to 35% of women in clinical hot flash studies responded to the placebo. So treatment for hot flash, what that we have here. So we have hypothala. This is balancing the chronobiology, or balancing the brain as it works then to support the pituitary. Femiferm supports female endocrine. PM Sync supports the female cycle and really diminishes the amount of symptoms that we see from day 21 through day 3. So I'm just going to talk about that right here. Femiferm is to be given to support the endometrium, support the mid-cycle from day 4 to day 20, being that the first day of the cycle is menstruation, the beginning of bleeding. So at day 4 is Femiferm, and up to day 20. Day 21 through day 3 is PM Sync, and that helps to diminish cramping, swelling, irritability, so forth. And then ZenAdapt is a power adaptogens to help the body cope with the stress that it has. So these 4 are very effective with hot flashes. So other hot flash triggers, lifestyle changes, too much sugar, too much fruit or carbs. The reason why they are pro-inflammatory. Alcohol is pro-inflammatory. Overboard or overboard on exercise. Spicy foods, that's going to raise, Ayurvedic talks about that, so that would be too hot, too much heat. Stressful situations, caffeine, and hot beverages. So again, more treatment. Top 5 minerals to benefit menopause symptoms. Vitamin B, C, this is C-comp, Cal-comp with all the calcium, and Occuvice. So folic acid, which is in B-comp, can calm hot flashes. Antioxidants also support collagen and reduce dryness and itchiness. That's antioxidants in C-comp. Cal-comp supports electrolytes lost in sweating. And Occuvice, a complete blend of minerals that combines a number of these other minerals. So Occuvice is for the eyes, but also supports overall mineral content, which can diminish those symptoms as well. Vitamin E is the antioxidant that works for some women, and the omega-3 fatty acids work with the cell maintenance and reduce frequency and intensity of hot flashes. Okay, so a common concern for perimenopausal and postmenopausal bleeding, and what's normal and what's not, and bleeding within perimenopause as you're approaching menopause, and in postmenopause, what can cause that. So not normal is having a few periods that last three days or longer than usual, having a few menstrual cycles that are shorter than 21 days, bleeding after intercourse, heavy monthly bleeding, and spotting between periods, and then bleeding outside normal patterns with hormone use. So these are not normal during perimenopause and postmenopause. So normal, a good count of blood, and anemia, of course, if you're losing too much blood, anemia would be something you could see, you'd watch for. So health practitioners should try to determine if problems are anatomical or hormonal. So if it's, if they're bleeding after intercourse, that could be just dryness, thinning of the mucosal lining as well. And excess bleeding can lead to anemia as well. So symptoms experienced around the time of menopause include common symptoms experienced: irregular skipped periods, insomnia, mood swings, fatigue, depression, racing heart, hot flashes, headaches, joints aches, muscle aches, so forth. Long-term problems experienced as osteoporosis, so suggesting that we need estrogen or we'll get osteoporosis. Dr. Platt's concept actually is that if we don't have enough progesterone, that leads to osteoporosis. Also, again, we want to think about acidity. How acidic are we? The foods that we eat, really desiring sugars, chocolates, that can create more acidity. Heart disease, poorly working bladder or bowel, Alzheimer's risk, poor skin elasticity, poor muscle power and tone, and weakening vision, cataracts, muscular degeneration, or macular degeneration. So this is menopause if those long-term problems extend. So the formulas that we want to look at, commonly used formulas are hypothala, pituitary, adrenex, that's going to support the stressors that we see during menopause, thyroidin, Femifirm, and PM Sync. So this is really where I look as I'm doing my scanning to determine where I should head. Is it a pituitary, is it hypothala? Is it down here at the uterus and ovaries, so Femifirm and PM Sync? Or is it a metabolic at thyroid, or too much stress with the adrenal? And that's where the kinesiology comes in. I wish I knew there was another way to know. So even if we did all the tests, we did all the salivary tests and urine tests and everything that there is to determine where the cycle is, how do we know where to hit, and how do we know how much to hit? So really we need to pay attention, I think, to kinesiology. Always I look to see if there is a layer of infection affecting anywhere along that line. If any of the organ or any of the gland is being affected by one of these: bacteria, metals, microcyte for small parasite, paramac, large parasite, fungus, and Phyroex. And then Lympha-X, our great new supplement that helps to dilate and open, clear and cleanse lymph. Beautiful supplement. Glad it's on board now. So most females suffer a degree of some abnormal cycles at some point in their life. So Femiferm and PM Sync are just tremendous. So you can read here and see when to take those. Kinesiology is a must to determine how much. Here's Manoferm and Femiferm can be used, and why Manoferm may test positive for females. So the balance of hormones may benefit some female patients by using Manoferm. So Manoferm is going to elevate a little bit of possibility of testosterone. It's going to give them a bit more push, if you will. Helps to support the libido. Just gives them a bit more oomph, if you will. Ovaries produce both testosterone and estrogen. So an imbalance of testosterone will have negative effects on a female, or likewise benefit males with Femiferm. Sometimes that shows as well. So if you're questioning endocrine, think about asking these two questions as well when you're doing your kinesiology. So here's the book, The Hormone Diet, by Natasha Turner, ND. Great book. Talks about dieting and talks about what they should have, how to diminish their inflammatory states. So this is actually 10 pages of questions that they just go down and make a check on the ones that they have trouble with. They add those up at the bottom. There's a place on there that they add them up. And then they come on the back, the very back page, they're able to put their number here. So anything greater than 11 marks placed is going to show an inflammatory state. So this is where you might be where you need to start. So you got to make sure the inflammation is under control, and then you work next with mood and food hormones, and then stress and anti-stress hormones, then sex hormones, then metabolism, then renewal, and then low growth hormone. That's kind of what she talks about in her book. Since I've been using this, it made it much more effective for me to analyze the patient. So I love this along with the kinesiology, and then just with the questioning and your clinical decision making. So assessments, beginning at the bottom, copy the result of each hormonal health profile into their sections. So again, that once they've added these up, then they add and put them into these points. And then one of my staff will go through with the patient and explain to them what they should be eating and so forth, and then kind of talk to them, and then I'll come in and we'll look and see what supplement would be the very best for them. So this has been very beneficial. So I'd encourage you very strongly to look at this book, Natasha Turner, ND. Yes, because the same meridian, as far as Chinese flow, the kidney meridian is going to run the adrenal glands, the adrenal support there as well, because the kidneys sit on top of the adrenal sits on top of the kidney. So if you have low energy to the kidney, weakness, you might have glomerulonephritis, or you might have chronic infective issues. Supporting the kidney along with Adrenex, and if you do acupuncture, acupressure, support the kidney meridian, that could really turn that around. And realizing that the adrenal glands are, and as we'll discuss next month, they're the pawn in the chess game. They're the first line of defense to stress. So when the adrenal glands are stressed all the time, they become weakened, burn out, and now you've got effect all the way through up to the thyroid. It starts to turn on more, trying to kick up the metabolism, taking over extra stress that the adrenal glands aren't handling. Then that again messes up the feedback loop back up to the pituitary. And stress then, if the kidneys are weak, it's usually because there is a lot of emotional stress, which then creates stress on the hypothalamus, and now you burn into hypothalamitis, and now you're going down the drag strip on your dragster, lost your wheels, and there's fire and inflammation all over the place. So I can definitely see the kidney, and the kidneys deal with fear. Along with Chinese, that the emotion is fear. So, and what's happening right now in our world? Think about our unrest and the feelings that we have, the stress that we have, and that's what can blow out the whole endocrine system. I remember in my 4th year of chiropractic college, when we had a guest speaker come in, and he was a practicing chiropractor, and he just said, you must know kinesiology. If you don't, you're guessing. And people that don't understand kinesiology think that it looks stupid or it looks weird. But the only way truly that I know, you're guessing. If you're saying, well, I think this might work, let's try this and this and this and this. But unless you can somehow query, whether it's electrodermal screening with a machine, or it's arm testing, or whatever form that you do, ask. And just know that the body will respond, but you've got to learn various ways of doing the kinesiology. Normally what I do is have the patient stand right in front of me next to my table where I have my scan tray, and they hold their arm out at a 90 degree. I put my hand roughly on their wrist, and I start with using the back part of my finger touching above their nose. That's in anatomical position, hands out to your sides. The front part of your body is positive, the back part is negative. So if I put my negative back of my pointer finger to the nose of the patient, that's negative to positive. The arm should be strong because those two electricities they draw to each other. So it turns the energy on in the arm. The deltoid that I've been querying or using as an indicator muscle should be strong. If I turn my finger now, point your palm towards their nose, it should go weak because there's now positive to positive, and the arm should weak because they repel. So that's how I determine strong arm, weak arm. Strong arm is a yes if I ask, do you need right now for your highest health a Drenex? I'll take the scan tray, put it to their chest, and push on the arm. If the arm is strong, that's a yes. If the arm goes weak, that's a no. So I would in my clinical decision making, and the symptoms that they've told me about, and the questionnaire, I would get my lineup of supplements that I want to try for their high, and I always ask, for your highest health, are these going to be effective? And then I start one by one, and I check them individually. Then I check them as a group, make sure that it's still strong. So I hold them in all the vials in my hand, check those just to make sure they're strong. And then I go back and dose how much they should have. So maybe it's going to be 3 Adrenex, 2 Pituitin, 1 Hypothala, 2 Femiferm, 3 PM Sync. And I go back once I'm all done dosing and ask, the dose that I've just given you, is this for your highest health? Strong arm, we go with it. Now, they might need to have some detox, or they might need to have some support in an organ of detox, such as liver or kidney or lung. So the Hirshheimer's reactions that we get can be diminished by asking, thinking about what, if they're going to detox, what do we need to have in place in order for that to happen? These are very strong supplements. They work great. We just have to make sure we don't overdose or overdo, because the symptoms that we are going to experience is because we've called upon the body to make those changes. And now we need to just make sure that we've got our filters in place to get rid of the toxin. But yes, you can put anything. So let's say that maybe that kidney has been chronically infected with a bacteria. Well, should we do Bactoex with Kidney Clear, with Adrenex? Now we're supporting that whole meridian. And now, even if you don't do acupuncture, learn a little bit of what points to stimulate just with your finger and acupressure that would help turn on the meridian to the kidney and adrenal. But people say, well, gosh, you're going to give them both? Wait a minute. Does the body ask for it? Did you ask? Okay, so this is a female, so Femiferm I'm thinking for sure. But could you give Femiferm and Manoferm? I would, absolutely. Would you want to do Femiferm in the morning and Manoferm in the evening? Possibly, or vice versa. Could you give them at the same time? Possibly. Do you think the body knows exactly what it needs? Do you think that the herbs in the Manoferm and the herbs in the Femiferm, that the body's intelligence has the ability to use and take and draw and put where it needs to? Absolutely. So don't ever think, oh, this will be too much, or this is going to flip them upside down, or Know that the innate intelligence that's governing us is there to deal with it. And people say, oh, herbs don't work because they're going to go through the stomach and they're going to get all digested, and it just doesn't make sense to me that, hydrochloric acid is going to eat all this up, and how does the body know where to put it? Are you serious? How does the body know constantly how to keep the calcium, the magnesium, the potassium, everything all in check, all at perfect balance levels? There is an innate intelligence within you. The intelligence, I guess I'm going philosophical here. Didn't quite mean to, but that absolutely you can do them together, and just know that the body's going to take that and know exactly what to do with it.